let's explore insomnia or sleeplessness. It's a common problem in our culture today, and certainly a bothersome symptom that can really affect the comfort of our hospice patients. And also, of course, the family or caregivers who are caring for the patient who also can't sleep. Everyone is affected. So what is insomnia? It is a prolonged and usually abnormal inability to get enough sleep. And either it's due to the trouble of falling asleep or even staying asleep. It's not just that one or maybe 2 nights, but it's a pattern of sleeplessness. We're going to follow an algorithm to both assess and then take measures to treat the sleeplessness. This algorithm was developed by a hospice agency, and it is to be used for educational purposes and as a reference source. It is not to be used as medical orders, as we will be considering some medications along the way. As in all symptom management, the very first step is to assess the problem, and that means firstly collecting enough information to understand the full impact and the pattern of the sleeplessness. So it's time for you to interview your patient, the caregivers, and the family, of course. And the questions you'll start with: what are the goals for sleep? People have different habits, and they may be quite different in what they like. Someone may want to be asleep by 8 and wake up by 5 o'clock, or another person's habit and a desire is to go to bed at 1 a.m. and get up at 9 in the morning. So first of all, what is their desired goal? And then what is the problem in meeting their desired goal? Can they not get to sleep? Are they having trouble staying asleep, falling asleep at the desired time? Or perhaps they can easily fall asleep, but they can't stay asleep. And then how long is the period of sleep before when they awaken and can't fall back to sleep? I have a patient lately who's complaining about not being able to stay asleep, and yet he goes to bed at 7 o'clock and he awakens at 3 and 4 in the morning. So that's 7 or 8 hours. So is the goal to sleep longer, or is it to sleep for different hours? It's really important to remind the patient of this and suggest changing hours of sleep so they don't awaken during the middle of the night. So again, first steps: determine the sleep goal and the current pattern. The next video will continue the insomnia assessment, starting with discussion of the circadian rhythm. Please visit our website, the Hospice Care Plan, to pick up your copy of our booklet. And don't forget our blog. Please make comments and ask lots of questions. That's how we know what to give you more information about and the support you need. Of course, subscribe to our YouTube channel, the Hospice Care Plan, and remember, Brenda and I are the care queens, because our motto is care is treatment.